Hi everyone, I am Dr. Sanchaita Kohli, an oral and maxillofacial surgeon from New Delhi, and today we are going to talk about a very popular procedure called jawline contouring. So what is jawline contouring? Jawline contouring or jaw sculpting is a surgical procedure that aims at changing the shape and size of the bottom edge of the lower jaw or the jawline. Now, why do we want to change the shape of the jawline? The jawline has a very strong correlation with the overall aesthetics of the face. Even a minor change in the projection and shape of the jawline can remarkably change and improve facial appearance. So how can the jawline influence facial aesthetics? Here are some common ways. Number 1, having a well-projected and well-defined jawline can actually make you look younger. It can add youth to your face. Younger people have stronger, more defined jawlines compared to old people with sagging skins. Number 2, your jawline speaks volumes about your personality. Having a weak jawline with a receded chin correlates with having a shy and timid personality. On the other hand, if you have a strong, square, well-defined jawline, it indicates that you have a confident and bold personality. Number 3, the size and shape of your jawline can make you look more masculine or more feminine. Males have stronger jawlines that are more square-shaped and more angular, whereas female jawlines are softer, rounder, and tapered at the chin. Number 4, the symmetry of the jawline is a very important facial aesthetic. Some people have a different jawline shape on the left and right sides of the face. So when they take a picture of themselves, they have a good side and a bad side of the face. This influences the facial aesthetics. So we can see that your jawline definition, projection, and symmetry is vital to good facial aesthetics. Now, who can get a jawline contouring procedure? People with square-faced jaws who are looking for a tapered or a V-shaped jawline can get a jawline contouring procedure and benefit from it. People with asymmetrical jawlines can achieve symmetry with a jawline contouring. Jawline contouring is an important part of facial feminization surgery for trans women. So how can you prepare for your jawline contouring surgery? Jawline contouring involves permanently changing your facial bony architecture. So this surgery requires good and detailed planning. During preparation, you will be advised certain X-rays or CT scans to assess the original size and shape of your jawbone. The contouring is then planned on these scans to make sure that the final jaw profile is visible to us before the surgery, and also make sure that the bone cuts are at a safe distance from any vital structures within and around the jawbone. Like any other surgical procedure, it is important before surgery to discuss any medical conditions that you may have with your doctor. You must stop smoking at least 2 weeks before the surgery. Improving oral hygiene at least 1 week before the surgery greatly improves your surgical outcome because the surgery is performed from inside the mouth, and hygiene leads to decreased rates of infection and better healing. So what is the procedure for jawline contouring? Jawline contouring is performed under general anesthesia through an incision given inside the mouth. The lower jawbone is exposed through this incision, and the bottom edge of the jawbone is shaved off or carved out using advanced bone cutting equipment, according to the planning and measurements decided before surgery. Depending on the extent of contouring required, the procedure can take from 30 to 120 minutes. The incision is then closed with a few resorbable stitches. At our center, we use advanced technologies like ultrasonic bone surgery, which cuts the bone exclusively and prevents any kind of injury to the surrounding soft tissues, nerves, and blood vessels. This makes the surgery much safer, more bloodless, and decreases the surgical downtime and makes recovery faster. We also use the 3D virtual surgical planning techniques where the patient can see the final jawline profile on the software before the surgery, making sure that they are well satisfied with their result after surgery. 3D printing of surgical cutting guides makes sure that we are able to execute the surgery precisely as planned on the software, and the results are predictable and more aesthetic. Jawline contouring may be combined with other procedures like chin augmentation, buccal fat removal, or masseter muscle debulking for more refined and more well-contoured results. So how is the recovery after a jawline contouring procedure? Jawline contouring is a safe and scarless day care surgery where the patient is allowed to go back home the same day after surgery. You will be required to wear a pressure garment on your face for 48 hours after the surgery to minimize the surgical swelling. There will be some swelling over the lower part of the face for around 7 to 10 days after the surgery. There will be some temporary numbness over the lower lip and chin region for some time after the surgery, which will completely recover in a few weeks. Most results can be seen within the same week after surgery, but fine results will be appreciable 4 to 6 weeks after the procedure. Thank you for listening to this video.